Welcome to Looking at Lyme, an educational podcast of the Canadian Lyme Disease Foundation, designed to increase awareness, empower listeners with expert knowledge, and explore solutions. I'm Kim Cairns. In this podcast, we talk with Dr. Eleanor Stein. Dr. Stein is a medical doctor and psychiatrist. The course of her career in academic medicine took a sudden turn when she developed a myalgic encephalomyelitis, chronic fatigue syndrome, fibromyalgia, and environmental sensitivities in 1989 during her psychiatric residency. She experienced the same lack of informed care that everyone else faces, and as a result, made the decision to focus her practice on chronic complex diseases. Since then, she has devoted her career to learning about these conditions and has worked closely with thousands of patients, integrating conventional and integrative approaches to help them improve their health and function. Dr. Stein retired from medical practice at the end of 2022 to devote her time to sharing what she has learned over the past 35 years. Through her website, www.eleanorsteinmd.ca, she provides free resources and paid courses. Thank you for joining us today, Dr. Stein.
You're so welcome. I feel privileged to be invited.
I'm wondering if you can describe your personal journey with ME and CFS and environmental sensitivities. What were the most challenging aspects of your illness?
Nobody knew anything. So when I became ill in 1989, I did what everybody does. I went to my family doctor. She was actually pretty informed, and she said, maybe you have this new thing called chronic fatigue syndrome. And remember, the criteria only came out the year before, so it was extremely new. She referred me to a so-called expert who told me I was depressed. So I'm sure many of your listeners have had this experience. And I thought, well, I am a little bit depressed because I can't do anything. Like I've had to back out of my residency program and I'm lying around the house and I can barely make it for groceries. So I'm not in the world's best mood, but I was in psychiatric training and I kind of knew what depression looked like, and it didn't really feel like what I was experiencing. I was upset, stressed. So fast forward, it was pretty miserable for the next 8 years because I just couldn't find anybody who knew anything. The real turning point came in 1997 when I met Dr. Bev Tompkins, who is, I believe she might be retired, but a family physician in Calgary who was a little bit ahead of me and had amassed a lot of information. That information helped me in a massive way and really made me decide this is what I want to do for my career. Because if other people are having the same problems I am, finding people who even know the name of the illness, never mind believe that you have it, never mind actually have something to offer that might help me cope. There's obviously a big need for this. I just want to add a little bit of a Lyme perspective. So in 2004, I came down with some really acute, I'm going to call it flu-like fever illness. I ended up going to a specialist because I was pretty sick, and he had the foresight to test me for Lyme, which came back extremely positive. So at that time, I thought, oh, maybe, I've had Lyme disease this whole time. I was lucky enough because I'm a physician, I'm in a little bit of a privileged position to actually get an infectious disease doctor to work with me. And I did a full-on course of intravenous Lyme treatment, and it made no difference. So I know everybody's story is different, right? But that was my story. So at that point, because that's pretty intensive, I can't remember the name, the cephalosporin that they give you intravenously. And I think I did it for 8 or 12 weeks. And I just thought, wow, I don't want to keep putting this into my body if it's not really going to make a difference. So psychologically, I kind of put the Lyme diagnosis a little bit to the side. But that was when I started educating myself about Lyme disease and going to ILADS conferences and trying to see if there were things I was missing. What's really interesting, just to kind of wrap up the story, is that in 2016, I kind of was struggling and I went back and got just a massive amount of testing. I'm sure, again, many of your listeners have gone through that. I redid all my Lyme testing. So I redid my Lyme testing right after the intravenous antibiotics, and it hadn't changed. It was still strongly positive. But then sometime later when I redid it, it had become negative. And so that's really influenced my thinking about Lyme disease a little bit, and somehow something shifted in my body that hadn't been there before that enabled me. And I've had Lyme serology again since then just to double check because I thought, well, that's really weird. And I'm still negative and I feel really well. So the tests are kind of in sync with how I feel every day. So that's just kind of a little personal anecdote that's maybe outside the norm, but that's my story.
I'm wondering what your perspective is
Hmm.
as a woman about, let's put it under the heading of depression. That seems to be a common theme with women.
Women get labeled more than men. So that has definitely been my observation over, the 25 years of medical practice where I was devoted 100% of my time. It was part-time because of my own health. 100% of my practice to people with complex chronic diseases, many of whom, of course, did test positive for Lyme disease, even though that wasn't my focus. The number of them that got diagnosed with depression, with stress, with menopause, really, I don't think any of those things were going on. It's upsetting because it invalidates their experience, right? They're having something serious going on. Their lives are dramatically changed, and they're being told, oh, just rest a little bit, or try to think positive, or relax, cut back a little bit if the stress thing comes in. The male patients I've worked with almost never got those labels, certainly not the menopause label. So there is some gender imbalance there for sure.
How did your experience with illness inform your approach to treating patients with similar conditions? What were the factors at play there?
I think the biggest thing was it really helped me believe them. The first thing I did when I met with Dr. Tompkins is I just sat in on her. She was generous enough to let me sit in for 3 weeks. So I sat there, sometimes reclined because I was pretty sick at that time. And I just listened and watched as 100, 150 patients, 200 came in, day out over that 3 weeks. And I heard so many common themes in their story. I just went, you know what? They can't all be lying. They can't all be hypochondriacal. They can't all be neurotic. They can't all be depressed because they all have these symptoms which are indicators of biological problems. And so that initial experience just really sealed my belief that there's something biomedical going on here. I'm a psychiatrist, so I'm not saying that's the whole story, but that's the core of what's going on. And what I'm going to do over the course of my career is to try to learn as much about that as possible and how to help people remedy those symptoms. If we can't get to the root cause, which of course would be the ideal, at least help them. A lot of what I've taught and still teach is self-management, right? Things people can do themselves. Like doctors tend not to be very helpful, unfortunately. And I think in the Lyme world, that's especially the case because doctors not only don't know a lot about it, but many of those who do know quite a bit are scared because they're being persecuted by their colleges, etc. People with Lyme disease really face a wall of lack of information and lack of assistance. And so part of my goal now is to empower people with things they can do themselves so that they don't have to rely as much on the medical profession.
So many Canadians don't have a doctor, and we're limited to bring up one concern per appointment, and we'll spend 15 minutes on it, and then you'll be out of here. So I think that instilling some sense of being in control of your journey yourself would be important.
I think it's essential when people realize maybe they can't cure themselves, but there's things they can do to improve their quality of life. It's a real turning point.
How do you help patients understand the complex interplay between physical, mental, and environmental factors in their illness?
So I just have to say that in my core field, which is myalgic encephalomyelitis, even asking that question would be forbidden. So thank you for asking it. I think in the case of Lyme disease, I mean, it's so obvious the environment has played a role, right? People got bit by a tick in the environment that was carrying Lyme and perhaps multiple co-infections. I don't even yet have the right language to answer that question because it's becoming increasingly clear to me that what we call the mind and what we call the body are one. So even to say the mind and the body are one is even incorrect. For blood and bacteria and molecules traveling back and forth between the brain and the body, there's no barrier. We could say, well, there is the blood-brain barrier, but really we're one entity. And we're also one entity with our environment. So everything we experience from the environment is kind of recorded through epigenetics, right? Our genes turn on and off constantly based on our interaction with the environment. So how much oxygen we get, what we eat, the temperature, our interpersonal relationships, our amount of stress, all those things, our body is constantly recording what's going on so that it can respond effectively and flexibly. The longer I'm in this, the more I think we're one big entity, and the boundary between the mind and the body is very, very tiny. And the boundary between our skin and our environment is not as substantive as maybe what we think. I think the bigger picture we can have, the more all-inclusive picture that includes our mind, our body, and our environment, and I'll say our social environment, right? And our economic environment and our political environment. These things all affect us on a daily basis.
What are some common misconceptions about Lyme disease that you've encountered in your practice?
Biggest one is just that it doesn't exist, right? We now have something we call chronic Lyme or long Lyme, which is people who are after that acute phase, and now they're kind of into the long haul where perhaps something has happened in their body that's kind of self-perpetuating. That's my view. Based on Dr. Robert Navio's work, I'm not sure if Lyme listeners would be familiar with him. His primary research is in ME, myalgic encephalomyelitis. He has a really beautiful model called the cell danger response, where he talks about, and he includes Lyme disease, autism, arthritis, a huge wide variety of chronic conditions in his model, basically saying we have some kind of a trigger. So in the case of Lyme disease, obviously that's being bit by the tick and getting the Borrelia infused into your bloodstream. And then what happens is all these downstream effects, and he believes that the mitochondria are kind of the gatekeeper of everything. And so when the Borrelia and co-infection starts causing inflammation, the mitochondria notice it because that's their job. And they say, oh dear, we've got a problem, there's danger, and they shut down. Once the mitochondria shut down, then there's not enough energy in the body to do the job of trying to get rid of the bugs. And that's what I kind of, this is my own idiosyncratic lay opinion of what happened to me, is that it took me all of those decades to get my body healthy enough that it was able to fight off the Lyme, turn my tests from positive to negative, could be correct or incorrect. So I think maybe one myth is obviously that it doesn't exist. It clearly does exist. Possibly a second misconception, in my opinion, that might be holding people back is that they feel that they have to counteract the initial trigger in order to get better. That initial trigger is a viral illness. In Lyme, it's the tick bite and the infusion of Borrelia. It might be the case for many people that yes, you have to use drugs or herbs or protocols to kill those infection that's in you. But it may be that if we work at a big picture level to improve the overall health of the body, the mitochondria that are keeping track of all of this go, oh, you know what? Things are a little bit better. I think we can turn on. When they turn back on and shift from glycolysis, which just makes a tiny amount of energy, to oxidative phosphorylation, which makes a big amount of energy, then all of a sudden the body has the resources it needs perhaps to get rid of infection. So one of my messages to people is if you spent a lot of time and energy trying to go back and turn around the initial trigger and it hasn't worked, maybe spend some energy trying to increase the overall health of your body. And it's possible, if my experience, I'm probably not the only one, so it could be possible that that could help you.
How do you help Lyme disease patients cope with their situation, with their own individual situations?
Coping as a psychiatrist, of course, is something I've spent really a lot of time thinking about, and a lot of people have come to me for help with coping. And I use a model that was developed by someone else. It's called the Fennell four-phase model, developed by Patricia Fennell, who's a social worker in Albany, New York. And I've used it for like 25 years. People really can relate to it. So I'll just be super brief. So there's four phases of coping. It's a little bit taken from Elizabeth Kubler-Ross's 5 stages of grief. There's some similarities, but of course, coping with a chronic illness that isn't likely to be terminal has some special challenges. If somebody's died, it's a very final ending. The psychological processes are a little bit different. So the first phase that happens is crisis. You're going along in your life, everything's great. You get suddenly ill. Now, in diseases like Lyme disease, the crisis doesn't usually happen right away when you get ill because you're still thinking, oh, I got the flu. Something's a bit off. I'll be fine. The crisis happens usually sometime later when you're not fine. Weeks or months have gone by. You're still feeling horrible. You haven't been able to go back to work. You've had to drop many of your responsibilities. You've gone to numerous doctors and they haven't been helpful. Now you're in crisis because now you're left with these really severe, debilitating symptoms. You have no idea what to do. And even worse, you're not sure if there's anyone who can help you. So in crisis, you're kind of scrambling. Stress levels are very high. The antidote to crisis is the second phase, which we call stabilization. So stabilization is where maybe you come to CanLyme, you start reading, you start listening to some podcasts. You're like, oh, thank goodness I'm not the only person who's gone through this. And here's some suggestions from people who were in my place some time ago and now they're doing better. And you start doing things like pacing your energy, maybe trying some herbal remedies if you don't have a physician to help you, letting your friends know that your capacity is going to be decreased for a while, maybe letting them know what kind of support you need from them. So that's kind of stabilizing so that you're not in this high stress crisis state. But to move through that to some kind of what we call integration, which is the fourth phase, you have to do this phase of what Pat Fennell calls the emotional heavy lifting. You have to go through grief. Because even if you get better, so even if you're one of the lucky ones and a year or two down the road, you're significantly better, you've still gone through something extremely difficult, potentially traumatizing. For most people, they've gone through it quite alone in terms of medical support. You've lost some years off of your life, you've lost things that you had been hoping to do. So that phase is really grieving, coming to terms with these things may never happen or may be delayed. There's a lot of uncertainty, which makes it very difficult. When you are in the grief phase, that's when you finally become willing to let go of some of the things that you've been trying to keep up with. Oh, I have to do this. I have to do this. My life depends upon this. So the grief phase gives you a little bit of a pause potentially where you can say, okay, my life has changed. I need to rebuild it as I'm able. What are my values and what are my goals? What gives my life meaning? What do I want to spend my time doing? Which people are the ones I want to have in my life? In the work I've done with probably hundreds, if not thousands of people using this model, believe it or not, some of your listeners will be like, no, I don't believe it. So that's fine. But some people come out of it better and stronger because they go, you know what? I really didn't need to be on that corporate rat race, or I really didn't need to be driving my kids to 17 activities a week. They're able to pull back and say, what are the one or two things I really want to prioritize that give my life value and meaning? Then they integrate who they were before they became ill with what the wisdom that they've learned through the process of the illness. And that's when you get to this magical place called integration, which of course you don't stay in forever, right? You come in and out of it because life keeps changing and throwing curveballs. I'm in a curveball right now, so I'm speaking from experience. Hopefully you come to a place of more acceptance where you're like, okay, you're able to face the reality of what happened and be somewhat at peace with it.
That's a great model. It's acceptance, but it's not resignation. That's an important foundation to lay for the future chapters.
Yes, and people really don't like the A word, the acceptance word. If I could count literally the hundreds or thousands of hours that I've spent talking about, because people are like, they're using the language they get from cancer or addiction. I'm going to fight this. I'm not going to give in. Acceptance is not anything about giving in or resigning. I'm just so glad you brought that up. It's about facing what is. The circumstances that led to where I am in this present moment have already occurred and I can't change them as much as I wish they hadn't occurred. I got bit by the tick on the camping trip in Maine, or I guess we're in Canada, in Nova Scotia. I'm now really sick. I wish it wouldn't have happened, but it has happened. That opens up a little bit of space to say, I'm going to go to the CanLime podcast and I'm going to try to educate myself about resources and strategies, and I'm going to see what I can do. If you're in denial, you're actually not going to take as many steps to help yourself as if you're like, okay, here's where I am. What can I do now?
How do you see Lyme disease and mental health interacting?
Really not an expert in this, but I've read quite a few papers where they talk about the neuropsychiatric manifestations of Lyme. So I'm going to call it a lay understanding. There's two parts to this question. One is I'm anxious and depressed and angry and frustrated because I have Lyme and I'm not getting the help I need, and months or years have gone by and I'm not better. So I call those kind of the secondary emotions or reactions to the circumstances in which I find myself. But then in Lyme disease, I'm convinced there's certainly cases of people where the Lyme or the co-infections themselves are causing neuropsychiatric symptoms, meaning they're causing anxiety, fatigue, cognitive dysfunction, depression, people waking up in the middle of the night with panic attacks that never had panic before. Maybe they're losing their precision of movement. There's just so many things that the brain provides for us that we take for granted that can be altered when you have Lyme and multiple co-infections. So that's different than I'm depressed because of my circumstances. That's my brain has changed. My brain is inflamed, let's say, and it's being impacted by the infection. And no amount of psychotherapy. So in my work, I try to disentangle those, because if I'm depressed because of my circumstances, then psychotherapy and support could be incredibly helpful to help me come to terms with it. But if I have, we'll call it a brain disorder that's biomedical, that's caused by the infection itself, compassion is helpful, but it's not going to change the brain. So in those cases, really, I think those are the people where really being persistent and trying to get Lyme literate treatment is essential, because we need our brain.
What's been your experience trying to get testing for Lyme disease for patients?
I practiced in Alberta. The routine testing there is the ELISA. It's like only maybe 50% accurate. I don't know the most recent numbers on that. People would come in, maybe they had a doctor who was a little bit creative and thoughtful and because they went in and said, I think I might have Lyme disease. And so their doctor did the ELISA, and of course it comes back negative, and then they're dismissed. So in my practice, I mostly did IGeneX testing. And then kind of in the later years, for people who wanted to go that direction, I was using Armin Labs as well from Germany, so that at least we could get an accurate picture of what was going on. But then the problem with that is when they went back to their family doctor and say tried to get a referral to an infectious disease doctor, that doctor would rarely, like I would say almost never, take those what they would consider alternative testing to be legitimate. And so it actually didn't help. I would started just letting people know that up front before they spent a whole bunch of money. If they're doing it for their own peace of mind, to know what's going on with them so that they can educate themselves and try to do herbal and self-managed accessible treatments, then that's great. But if they're doing it with the expectation that the medical system is going to respond to those results, they may be disappointed. So I just want them to know that up front. It's incredibly frustrating, right? To have a disease where there are tests. They're not 100%, but they're pretty accurate. And they're either not accessible at all, because most of the people I've worked with over the past 25 years are living in poverty because they can't work and they've gone through all their money. So for them, even a basic IGeneX panel is sometimes just out of reach. It's frustrating that in Canada, where we have supposedly universal health care, and let's just pray we keep what we've got, it doesn't include certain diseases, and it doesn't include Lyme disease.
Lyme is actually starting to increase, or awareness of it is increasing. Who knows how long it's been there, but now it's starting to be alive in conjunction with climate change.
Yeah, I think it's increasing. I mean, the little bit of reading I've done on it, and I'm trying to remember the woman's name who did the testing the ticks from veterinary samples, like from dogs, and found out that dogs in every province of Canada have Lyme-bearing ticks. That tells me that in veterinary medicine, they're way ahead of us and they're open to it because we all know dogs get ticks, so vets are on top of it. And if their dogs have Lyme disease, then obviously the owners are at risk. So I think global warming is making it more prevalent.
What advice would you give to, I think you've already answered this actually, advice you'd give someone newly diagnosed with Lyme disease? I think you've laid out a pretty good roadmap for people to at least embark on the journey with some awareness.
Educate yourself. My little mantra, on my website and the work I do now is education, empowerment, and hope. I think your organization is just a godsend for people as a place they can go to get really accurate information. And now with this podcast, to hear from a whole bunch of experts in specific areas, the education, learning, what can I do to improve my health, irrespective of what help I may or may not get from the medical system, is super empowering. And then I would say listen to stories. I think you've got some on your podcast site as well of people who have gotten better. Listen to their journeys. It'll help you in two ways. One is it will help you realize that it's not simple. So it will set expectations, suitable expectations, right? So that you're not constantly being devastated when you try yet another strategy that doesn't work. So know that these are really complicated diseases. I feel great, right? I don't feel like I have any remnant symptoms of Lyme disease. I'm incredibly lucky. Not everyone has that great of an outcome, but many people do get substantially better. The way that you're going to get better is to learn as much as you can and try to implement as many things yourself that are recommended by other people that have gotten better, basically, and by the medical experts. There's lots of great websites out there now on Lyme disease that, can really give people the information they need.
How do you approach the issue of pacing and energy management with your patients?
In my core population who have ME, they have something called post-exertional malaise. So the definition of that for anyone listening, maybe you haven't thought of it in these terms because it's maybe not quite as, awareness isn't quite as great in the Lyme world, is that you do something that you used to be able to do with ease and you crash. Like you're absolutely exhausted and it takes you more than 24 hours to recover. So that's the definition. And so the implication of that is if I did something today, it could be something as simple as going grocery shopping, right? Or talking to a friend on the phone or sitting outside in my garden. This is for people that are severely ill. We're not talking running marathons. We're talking activities of daily living. And it takes you more than 24 hours to recover. Then that's not a sustainable activity. Each time you notice that shift in energy, the crash, and you notice how long it takes you to recover, you want to kind of make an estimate. Well, how much energy did that cost me? There's something called the spoon theory, which is super practical, and you might be able to put a link to it. The spoon theory says, how many spoons do I wake up with today? Maybe I wake up with 10 spoons. And those spoons are very individual. So for me, a spoon might be an hour of upright activity. A lot of us also have orthostatic intolerance, and being upright is already a little bit challenging. So I need to know how much energy or activity I can spend with each spoon. And the goal of pacing, I tell people, is to end every day with 1 or 2 spoons left over. Do not spend all your spoons, because inevitably what's going to happen is something unforeseen will come. Your child phones from school that they're sick and they need you to come pick them up and take them to the hospital. Your dog does something that requires immediate attention. Your partner gets sick and now you have to do some of their tasks. So many things. You always need spoons in reserve. I've just kind of read a book that's just come out in my field, and several experts are saying the number one goal is to avoid crashing, because every time you crash, your mitochondria, who are monitoring your energy, go, oh dear, it's dangerous out there. We better shut down and wait this out. And as soon as that happens, now you can't recover from the crash because you don't have that natural energy production. So I would say number one rule of pacing is adjust your activities to the amount of spoons or the amount of energy you have, not the other way around. Never push through and avoid crashing.
What are some of the most important lifestyle modifications that you recommend to your patients?
My website is literally filled. My YouTube channel, I think I've got like 130 videos now. So I'll just try to keep it really succinct. Where I'm at right now, I'm actually heading in a little bit of a different direction than what I've been teaching for the last 25 years. It's utilizing our natural environment. It was super surprising to me, say 6 months ago when I started learning about it. But just like plants get energy directly from the sun to grow and become lush and big and succulent, we do too. We absorb red, infrared, and ultraviolet light from the sun, and it powers our mitochondria. So if you're very sick and your energy is very low and you have the capacity not everyone does, like you live in a big apartment, it's sometimes hard to get outside. But if you have the possibility to get outside, even if it's the Canadian winter, do it. The more time you can spend outside, even if it's cloudy, even if it's cold, you're absorbing red and infrared. It's present all day. So ultraviolet, we don't have a lot of in the Canadian winter because the sun's just not that high on the horizon. But red and infrared is available to us all day, every day, as long as the sun is above the horizon. Say if there was one thing everybody could do, and ideally try to get outside first thing in the morning, because that will set your body clock for the day. So get outside. If possible, do it first thing in the morning.
Thank you so much for joining us today, Dr. Stein. Make sure to tune in next time as we engage with more experts from Canada and around the world.